Hi everyone, my name is Jess, and today I'll be talking to you about the importance of assessing social validity in OBM. So to start, I wanted to talk about what social validity actually is. Maybe this is the first time you're hearing that term, or maybe this is a refresher for you. Either way, this term was arguably first posed by Montrose Wolfe in 1978, and this concerns the social significance of the goals we select, what we're trying to accomplish, the appropriateness of the procedures we select to accomplish those goals, and finally, the importance of our treatment outcomes. So usually this is involving subjective measures, which is somewhat unique for the field of behavior analysis. But in his paper, Wolfe suggested that the shortcomings of subjective measurement should not lead us to reject them outright. Instead, behavior analysts must develop measurement systems and set conditions that promote accurate reporting. He really drove home the importance of collecting data on consumers' opinion regarding our interventions at these three levels. So, one term that is used somewhat synonymously with the term social validity is treatment acceptability, and I like to think of this as corresponding with the second level of social validity posed by Wolfe in 1978. In OBM, Parsons called this procedural acceptability. So they were really one of the first to discuss the importance of assessing social validity in OBM. And in particular, they used the term procedural acceptability as sort of synonymously with treatment acceptability, I would say. So that is the term that I'm going to be using for the remainder of this video. And Parsons described procedural acceptability as assessing consumer satisfaction with management procedures. So when you think about consumers, we're talking about people who are impacted by the intervention in some way. And so in particular, to what extent do which consumers view a particular management practice or procedure as fair, appropriate, non-intrusive, consistent with standard practices, and unlikely to result in negative side effects? So, procedural acceptability data can be useful in several ways. First, it might allow us to predict intervention viability or the likelihood of institutionalization. So, the idea that our intervention procedures will be used after we leave. In addition, as Kasdan has suggested back in 1977, procedural acceptability or social validity data can be used to help protect the rights of consumers. It's allowing us to give them a voice and ideally a choice and a say in our intervention development. In addition, it might allow us to protect against the negative impact of unacceptable or undesirable procedures. So I'm going to go through a couple of examples as that pertains to OBM in just a moment. So here we have some examples of potential undesirable effects of unacceptable management or intervention procedures. So to start, absenteeism and turnover can be very costly for organizations. If you think about an employee who has been exposed to some practice at work that makes them feel really uncomfortable or unsafe, they may be less likely to go to work and they might eventually choose to leave their job. And so this can be quite costly and undesirable for organizations. In addition, it might lead to disputes between labor and management. They might be less satisfied with their job, and sometimes it might even impact the quality of life of employees both in and outside of the workplace, which can lead to negative effects on their health as well. So just a few examples here of why it's important to assess social validity or procedural acceptability to protect against these negative side effects as much as possible. So now that we've covered why procedural acceptability is important, I'm going to briefly talk about how you assess procedural acceptability in an organization. So who you ask, when you ask them, and how you ask. So who or with whom you assess procedural acceptability can be quite important and yield very different results potentially. So here I have listed a couple of different types of consumers. They might be directly impacted by the intervention or perhaps more indirectly impacted. So if you think about frontline employees, let's say it's a performance feedback intervention. The frontline employee is going to be the one in this example, receiving that feedback. But also, you need to think about the supervisor who is providing that feedback and how acceptable are those procedures for them. You might also assess the acceptability of a given intervention with leadership or the recipient of services. So let's say the performance feedback is being delivered to retail workers. You might ask individuals who are shopping at that particular store how their experience was. And finally, sometimes with social validity more broadly, we might solicit the opinions of experts on some aspect of the target behavior. So I think interventions in OBM might be particularly unique in that our procedures might impact these multiple levels of an organization in different ways. So you have to be really intentional when you think about who you are going to ask in regards to procedural acceptability and assessing the applied value of your intervention. So next, let's talk about the how. So there are several methods for assessing procedural acceptability. In this video, I'm going to cover just a couple. So to start, we have rating scales. You think Likert scale, so from 1 to 5, how much do you agree with a given sentence? So rating scales are most common from what we have seen in interventions that would classify or qualify as OBM. So they've been used quite commonly, but they may not be the most sensitive to preference. So, for example, an individual might indicate a high rating for a performance feedback intervention, but let's say we also had a discrete choice arrangement. So when given the choice to receive performance feedback, although they rated the intervention highly, they might opt out of receiving feedback. So for this reason, we can think about discrete choice arrangements as sometimes providing more useful information and perhaps being a more sensitive measure to preference, although they have been employed less frequently in the Journal of Organizational Behavior Management. Another option is to pose open-ended questions. So this might be via surveys or interviews face-to-face with a particular consumer. And so it's important to note for this type of question assessment procedure that the response effort might be higher on both the interviewee and the consumer. So as an interviewee, let's say you have to go or arrange a time to meet with the consumer via Zoom or if you're in person, and the consumer has to engage in more effort to respond to these questions as opposed to just selecting 1 through 5, how much they agree, or selecting a discrete choice. But despite this higher response effort, the data that we get from asking and posing these open-ended questions might provide a greater breadth of information, and potentially that information may be more useful. So for example, if we have a rating scale and participants rate a particular intervention as being less preferred, with an open-ended question we can ask, why? Why did you not prefer that intervention? And that information might be more useful to inform treatment development, which when you're collecting data on procedural acceptability, you want to use it in some capacity. So we need to think about the ways in which we ask for consumers' opinions and the types of data it might yield and how that data might be useful for us to inform our intervention or make some modifications accordingly. So let's discuss an example here. So let's say you have developed an intervention which involves supervisors delivering feedback to increase appropriate PPE usage. So PPE standing for personal protective equipment, think arm guards, for example. So we're trying to increase the usage of PPE in an ABA clinic. So I would like you to pause for a minute and consider possible outcomes across methods. So rating scales, choice arrangements, and the use of open-ended questions. So let's walk through some ideas I came up with in terms of potential outcomes across methods. So to start, considering the use of rating scales, a person might rate their acceptability of receiving performance feedback as a 3. So those data are somewhat interesting, although not terribly useful on their own. Specifically, if I see that an intervention was rated as less than favorable, I'm going to want to follow up and ask why. Likewise, let's say we used a choice arrangement, and in particular, perhaps we gave employees the option to receive feedback from a peer or their supervisor, and each employee chooses their peer to receive feedback. So no one chose to receive feedback from their supervisor. Well, that might promote some additional considerations regarding why the supervisor delivered feedback may be less preferred. Or let's say we offer them the choice to pick which supervisor would deliver feedback. Under those conditions, I might be interested to learn more regarding why one supervisor might be more preferred over the other. Do they have a stronger relationship, or is it related to how they deliver feedback? Perhaps there is some aspect of the way they deliver feedback that makes that feedback more acceptable or more effective, and we might be able to learn from what they did to help promote more effective and acceptable feedback provision amongst other supervisors as well. And finally, we have open-ended questions. So these can be particularly useful for gaining information that you might not have predicted. So, for example, one common question that myself and my colleagues will pose is, what went well during the intervention? What didn't go well? So one employee might share that they felt the expectations for when they wear PPE was unclear. And this information is really useful to us because then we know, okay, there's an opportunity here to clarify expectations. And from there, we might observe and reintroduce performance feedback if necessary. It's possible that a simple clarification of expectations might have a sizable impact on their PPE usage, but it would give us an opportunity to observe and then decide whether or not performance feedback delivery is still necessary. So, depending on the type of intervention that you are trying to assess, it might be useful to employ multiple methods of assessing procedural acceptability. So even after you have selected your method for assessing procedural acceptability, there are numerous other variables that you need to consider which might impact the accuracy of reporting. So here I have a couple of examples listed. So first you might think about who conducted the assessment and how the assessment was conducted. So let's say you have a supervisor who's conducting the procedural acceptability assessment and they're doing it via interviews. Well, that might lead to an employee being less likely to report accurately. For example, if they were unsatisfied with a given intervention component. Whereas if you had asked them via a survey, perhaps then they might feel more safe reporting their opinion on a given intervention. In addition, you want to think about, if it was a survey, was the survey anonymous or those responses identifiable? So an employee might have some concerns for a negative response from management or leadership if they have something less than desirable to say about a given intervention. So you want to keep that in mind as well. In addition, who has access to those data? Even if it was collected anonymously, who is the one who's going to be analyzing those data? Is there a way that their response might be traced back to them? So really here what we're doing is considering barriers and concerns that employees might have with reporting potentially negative outcomes. So really we want to be intentional here regarding how we arrange conditions such that accurate reporting is more likely. So finally, we have the when. So ideally, you want to assess acceptability before, during, and after the intervention, if feasible. So for example, let's say you created a safety observation system to evaluate safe lifting practices in an industrial setting. So at the outset of the intervention, employees might say the intervention sounds great. They might rate it quite favorably. Whereas during the intervention, it's possible that the supervisors who are conducting those observations, they might reveal that their existing workload is too high or it's too difficult to fit those observations into their schedule. So let's say you're the consultant in this example. You might work with those supervisors to either adjust their schedule or perhaps the frequency of observations to free up more time or make their responsibility in the intervention more feasible. And then after the intervention, the supervisor might report that despite the high response effort for conducting these observations and providing feedback, the intervention did seem to increase safe behavior, and therefore they found it useful and worth continuing. So here, just one example of how acceptability might change over the course of an intervention, both before, during, and after. So in conclusion, I want to make it clear that social validity standards, so procedural acceptability, as Schwartz and Baer put it, should be a minimum requirement in research and practice. So as an individual, perhaps a consultant, or someone working in an organization helping them develop an intervention internally, you want to plan and advocate for the use of social validity procedures at the outset of the intervention, and ideally assess before, during, and after the intervention if possible. Very important. Also to assess the acceptability among all relevant consumers. As we noted earlier in this video, the outcomes of assessments of procedural acceptability can look very different at different levels of the organization. So you want to be conscious and intentional regarding whose voices you're allowing to be heard and how. And finally, and most importantly, when you are collecting data on procedural acceptability, you need to consider how those data will be used to inform subsequent action. So you're not assessing social acceptability or the applied value of your intervention just to do it. You're not going to file that away. Ideally, you're going to use that data to inform some action, perhaps some program modification or something along those lines. So, in conclusion, we've talked about social validity, we've talked about procedural acceptability in OBM, why it's important collecting those data, and some general considerations for how you might do so. I hope these tips and this information has been helpful to everyone. Thank you so much.